Did you guys always feel dizziness, fatigue, or shortness of breath? It's not always about your breathing or always about your lung. It may be due to your disruption of your blood. In this video, I will give you some protocols, some physiologic tools, or scientific tools. By applying those, you can maintain your blood volume and unlock your full potential. You may say. Now, so in starting of this video, I want to talk about some anatomy and physiology of this blood or blood circulation, because uh, if I give the protocol directly, it will not be you won't be able to understand how to apply it or how to efficiently apply those scientific tools. So let's talk about the anatomy and physiology about this blood or circulatory system. So the first thing is, in blood we got two portions. First thing is plasma, and the second portion is cells. So what is plasma, where it is coming from? It's the liquid portion, means most of the portion of plasma is water, but it has some things, you can say antibodies, which are, after vaccinating or getting exposure to any disease, means first time you are getting pox, you are synthesizing some antibodies in defense mechanism against it or against the disease. So those antibodies lies in plasma. Most of them circulate through our blood almost our entire life. And there is another thing called clotting factor. So clotting factor, what does clotting factor do? Clotting factors are helps in when you get a cut or any type of bleeding, it get clots, so it helps there to form. The platelet has also some contribution to the clotting system, but in plasma there are some components of it which are called clotting factor. Okay. Then there is the cell. Okay, the cell portion comes from where? The cells portion are normally deriving from bone marrow. Now, those of who doesn't know what is bone marrow, it is the cells or stroma inside the bone. So from there we get these cells. So what type of cells are there in blood? There are three types of mainly. You got RBC, which are red cells, which contains the hemoglobin, and that's why the blood is red in color, because the red blood cells most abundant in number. And then we have got white blood cell. They are not white, but you can say they're kind of transparent, and that's why they are called white blood cell. And we got platelet, which helps in clotting, or when we get a cut, it helps in clot formation, stop the bleeding. Okay. So let's start from the plasma. So the first thing, first abnormality you can cause in plasma is the volume, because you are water deprived all day all night. Most of them doesn't take drink water at optimum level. So what happens is the volume get decreased. Now, the function of what is the function of blood? This plasma carries food, nutrients you are taking, it carries from your gut to the peripheral cells that needs those components, or oxygens from your lungs to those peripheral cells, or taking those carbon dioxide from the peripheral cell into the lungs. And when the volume get decreased, this function got hampered, because heart needs to pump and circulate the blood, taking it from your lungs to the cells and taking from cells to your lungs. So the heart also needs to hyperfunctioning for this reason. So the blood volume thing is, or plasma volume thing is a must to maintain. So what can we do? What we can do, uh, first thing in the morning you should take water, because the whole night you are not taking water. It's a long 8 to 12 hours of gap of water deprivation. So what can you do? You can take water, but the protocol is, or optimum protocol is, you should take a pinch of salt inside a glass of water, and you can take a lemon, due to which you are taking a hypertonic fluid. And what hypertonic fluid do, it extract the fluids or liquids uh, which were inside your body into the bloodstream. It is a function of hypertonic fluid. So it will help to regain the volume as fast as we want. Okay, that was the plasma. And now the blood cells. In case of blood cells, we got RBCs. Now See, RBC got hemoglobin, and the main function of hemoglobin is to taking oxygen from your lungs to your peripherals, and every cell needs oxygen, because oxygen is required for glycolysis, by which you produces energy, and it, using those energy we are functioning, we are moving, we are talking, we are speaking, we are thinking. But when you got a little bit of low concentration of hemoglobin or RBC, means RBC contains hemoglobin. So low RBC or low hemoglobin means you will get less oxygen. So when the oxygen is less, so the oxygen when the hemoglobin is less, so the oxygen carrying capacity decreases of your blood. So y- the cell will get less and less oxygen, and what will happens is um the energy production will get low down. So you will always feel fatigue or dizziness, something like that. And then the other hand, you got this disease called anemia. Now, hemoglobin concentration is low doesn't mean always means anemia, because anemia has so much types and so many subtypes, something like that. So what we can do, we should always keep our increasing hemoglobin or RBC formation. The RBC doesn't has any nucleus, but its precursor cells, means where it comes from, they contain nucleus, and for this nucleus growth, you need vitamin B12 and folic acid, or vitamin B9. Folic acid means is vitamin B9 or B7, something like that. You can Google it. I think you will find out. And for the formation of hemoglobin, we need iron, because the core component of a hemoglobin is iron. So we need these things. Means we need iron, we need vitamin B12, we need folic acid. So these three things we will need to um, maintain a healthy red blood cell component. But the thing is, you can Google those things, like for food, which type of food I should take, so that there is increased amount of iron, vitamin B12, folic acid. But I will say some of it, it's splenic, or what is it's called, spinach, broccoli, lentils, beef. This contains all three of these. But here's the catch, and the catch is you shouldn't take iron with caffeine, because what caffeine does, it reduces the absorption. So you take a lots of iron for your body, for your health. But when you're getting it with caffeine, what is happening, you are just passing it through your gut. You are not really absorbing it. So what you can do, you can take iron with vitamin C. Vitamin C, what vitamin C does, it converts the ferric form into the ferrous form of iron, and ferrous form is easily accessible for gut to absorb and take inside of our body. So it actually facilitates to cut off the caffeine with iron. Take a gap between iron rich food and caffeine, but take vitamin C's with iron. It will help you guys a lot. Okay. So that was about red blood cell. Okay, another thing about plasma is that when you breathe through your nose, it's most optimum thing you can do. Always breathe through your nose. Never ever breathe through your mouth. And in spite if you got any type of nose block or something, because when you are breathing through your nose, you are actually producing a chemical substance which is called NO, nitrous oxide, nitrous or nitric. I'm not sure. It's NO. So what it is do, it's actually a vasodilator means the blood vessels got dilated by this substance. So what happens is when your blood vessels are dilated, the flow of blood is good to the peripheral cells or the portion of your body, and heart needs to less function. So what happens is you are using less energy, and it will carry the oxygen to the peripheral cells easily. Okay, and that was about RBC. And another thing about plasma is um, we're always producing these waste products from inside our cells. Mainly two of those is one is carbon dioxide, and another one is uric acid, urea, this kind of thing. Now, carbon dioxide is expired through our breathing system, but the uric acid or urea, these guys need water. Means you are taking less water, so you are urinating less. What is happening is your blood volume is getting less and less, and blood is getting concentrated, and also there is the urinary concentration, means uric acid, urea, this concentration inside the blood are increasing, which is not good, because this accumulating waste inside your body, it's not good. So you have to take water. So what happens when you take water, it absorbs inside your gut and goes into your circulation. It is important, it goes into our circulation, and means it diluting your blood, means not too much diluting, I mean absorbing the water, increase the blood volume. And then when kidney filtrate those blood, or filtrate the plasma, what happening is this water is taking those waste product, means urea, uric acid, they're taking it down to and passing it through your urine. So that's why for urination, water is needed, and plasma, for maintaining the plasma volume, water is needed. Okay. So then second thing we will talk about, let's talk about WBC. Now, most of scenario, WBC works as a protective mechanism of our body. It destroys bacteria, it destroys viruses, it's work against parasites, many of these things. Most of them you guys know it. But what I will talk about and most interested about is natural killer cell or NK cells. And when you are sleep deprived, this cell got its function so less. You see, every time, every day, every moment, our body is producing tumor cells, or our body is producing um, cancer cells. But these NK cells are always destroying them and keeping us safe. But when you are sleep deprived, I saw a research that where it says it reduces the function of NK cells by 70%. 70, which is very bad. Okay, so and there is another disease, you everybody has heard about leukemia. So what is leukemia? Leukemia means there is in number of increase in cell, white blood cells number is more than normal scenario. Now, where are they coming from? We talk about that every blood cells are coming from bone marrow, but the thing is, it's a hyper functioning bone marrow, which causes a hyper production of WBC. This causes leukemia in general concept of view. Okay, so now, in leukemia, you guys have heard about surgery, which is called bone marrow replacement, something like that. So, what happens is in this, you guys thinking it's a complex surgery, but for donor, it is. It is a complex surgery for a donor, but for a recipient, it is not. Because you see, the stem cells, I need stem cells because my stem cells are hyper functioning or becoming abnormal. So, what is my stem cells are doing? Stem cells are converting and converting. More and more WBCs. So what I want to do, I need uh, normal stem cells. Now, stem cells can lies inside of bone marrow, and also it can circulate through our blood. But it prefer to stays in bone marrow because there are comfortable environment. There are growth factors which helps in doing its job. So for donor, I have to take the stem cells from donor. So I have to cut open his bones and get inside his bones, and then takes those stem cells. But from recipient, what I need to do, I have to just put inside intravenous, means put through the cells into blood or vein, and they will circulate inside their body. And when they reach the bone marrow, they will find the comfortable environment, and they will stay there. And that's how it works. But means donor have to suffer more in this scenario, which kinda tricky. Okay, so and that's what that was about the WBC. And WBC we can apply, means it, you want your WBC to function well, you should sleep every day. Perfect sleep needs to be done. And then let's talk about platelet, the last portion. In platelet, it's most of the scenario when you get cut, then you are applying those or using those cells. So it has not that much of a view, but sometimes you got some disease like um, thrombocytopenia, means you guys heard about that frequent nose bleeding without any injury, or gum bleeding without nothing, with any bruise. It may most of the scenario it may caused by thrombocytopenia. Thrombocytopenia means less platelet count inside your blood. So what happens is, we are always getting these cuts inside our body. Inside our body, we always getting microvascular ruptures. It's a physiological process. It's not abnormal or anything. But what the platelet is doing every time we are getting ruptures or vascular ruptures, it maintaining the normal physiologic process by clotting those area or fixing those vascular cells. And when the counting is less, then what is happening is you doesn't have that amount of platelet, which cause rashes or nose bleeding without any injury, or gum bleeding, this kind of scenario. So healthy food intake will fix that, but it has not that much of a optimal protocol or physiologic hacks. But maintaining plasma, maintaining RBC, and maintaining WBC by sleep, these things are crucial for your health. You never can compromise it because it's just saving you from a lot of things daily. Now, this video was not a medical professional like video. It's just a educational video. Although I'm a medical student, but I can just give you any medicine subscription or something like that. If you guys are facing those kind of thing, please go to hospital and take doctor's consultation. But it was educational video. Apply these things and make your life easier, and breathe normally, sleep normally, eat normally, and stay healthy. Bye.